And today's topic is pain with intercourse. Why are we whispering?
Because it's kind of an intimate topic.
Oh, okay. And so it's intimate. That's why we're in the bedroom too, right? But there's two issues with pain with intercourse that we really want you to be aware of and know that there's help for this, okay? So the first issue is pain with penetration.
And pain with penetration can occur because of tearing that might occur when...
Or an episiotomy.
Or an episiotomy, right?
Yeah.
And so what happens is, if I may show you the anatomy, here's the vaginal opening, and this area down here, the perineum, needs to stretch in order to allow the birth to happen. And in up to 70% of women, that can tear, or it could be torn
Through episiotomy.
Through episiotomy.
Yeah.
So, but when it heals, it builds up scar tissue, and that scar tissue needs attention so it can then move the way it normally did.
Yeah, scar tissue doesn't move as well as normal tissue.
Anywhere in our body.
Right, and any other place, whether we've had a surgery or we have scar tissue in there, we're instructed to massage it, to break up that scar tissue, to stretch it out.
And to allow the layers of tissue to move upon each other smoothly.
Yeah.
So you want the same thing to happen here as in anywhere else in your body, and
Yeah.
that's what we can help you with.
Right, and so one of the best ways to help mobilize scar tissue is actually having intercourse, if you can tolerate it. And so if it's too painful, I always encourage my clients to go really slow, and if you do it the first time and it's really, really painful, the next attempt, if it's not 6 months in between, which we know can happen, if it's relatively sooner than later, every successive attempt should get better. It shouldn't be as painful.
And the tissue just adapts.
Yes.
It stretches and adapts. It should, right. But if it doesn't,
if it's not willing to, then that's what you and I are so good at.
So that's where we come in to help.
Yes, right. So Jeni and I have a really good skill of listening to the tissues and feeling in to see if there's something being held in those tissues.
Yeah, after birth, there could be a lot of emotion that's held in the tissues, or trauma
Yes.
that's held in the tissues, and that's where we come in to help you work with that.
And I feel like trauma in the body is kind of like the tissues down there, like holding their breath, like,
yes.
Yeah,
yes.
It's like it hasn't exhaled. It's to release, to let go, and it's being held like this. And with penetration, those tissues need to be able to expand. And what saddens me so much is having moms come in to tell me and say, yeah, I went to my doctor and the doctor said the tissue's normal.
Good.
Yeah. So try a little more wine.
Yeah, lubrication.
Yeah, and with what we've experienced, no amount of wine or lubrication is going to release tissues that is holding because of trauma or stuck emotion or whatever might be in there.
And you want those tissues to work functionally, and you want them to heal correctly. So wine and lubrication is great. I'm not saying that's not. But you probably want your body to work.
Yeah, and that's why, a lot of practitioners don't give it more time. Well, yeah, maybe in a year it might be better, but we can help you most likely in one session. So you don't need to wait that 10 months to a year to allow it to be comfortable for you. Come in and get some help, and we'd love to help support you. So talk about the second issue.
Second issue is pain with thrusting.
Yeah, deep thrusting pain, right?
Here's our picture.
Yeah. So with this, this is your uterus, this is your bowel. When they go to, so usually deep thrusting happens with cesarean births because we have scar tissue from the C-section that would be right here. So it creates scar tissue, and then it just kind of limits all this tissue's mobility right in here.
That's like a wall.
Yes, a brick wall. A brick wall, so that when the penis comes in and it's trying to get these tissues to move out of the way or mobilize with it, it doesn't do it. It's hitting that brick wall, and that brick wall is that pain response.
And we're able to help you loosen up some, break up some of that scar tissue between the uterus and the bladder.
Right. So you need to massage your C-section scar.
Oh, indeed.
Yeah.
Yeah, I've had one.
Yeah, and you probably need to do it for the rest of your life too, right?
It's a constant job. I'm often on my C-section scar because there's one side that's tighter than the other, which I
Usually always
find
the
that
case.
anyway.
Yes.
And I'll just do that and then work with my core, breathing, and those are
Yes.
things that we could teach you to do, but come in and learn how to do that.
Well, let us release this for you and get it loosened up, and then we can just teach you how to maintain it. Right? So that's the big piece. So please know that if you are having any pain with intercourse, that you don't need to live with it. There is something going on, and we can help you to release it and help you to be able to enjoy intercourse again without pain.
How nice.
Right?
Yeah.
Yeah, it should be enjoyable.
Yes, it
Right?
should be.
Yes. All right. So come on in and let us help you out.
We hope to see you.
Take care. Bye.